This is Dr. Shim Ching, board-certified plastic surgeon from Honolulu, Hawaii. Today I'm going to talk to you about cheek filler. What is it? Why would you want it? And how does it make you look younger? So having been around for about 25 years now in this field, I've seen that initially fillers were used to make lips larger and fill in little lines in the face. Since then, we've really grown the use of them to do a multitude of different things, such as to reshape the face. And this is very useful. In patients, we can make the chin larger, the cheekbones more prominent. You can change facial features like this because the different kinds of fillers that have been developed are thicker, stronger, and can hold up to give structure to the face. Now, one hallmark of aging is sagging of the face. Everybody understands that as you get older, everything descends, everything gets saggy, everything gets lower, and that's what people don't like when they get older, which makes them look aged. So the usual approach for me is to offer somebody a facelift. A facelift is always going to be the best option in terms of the best result, the longevity of the result, and I feel the most natural result. And this is because of facelift, we are restructuring the face. We are disassembling your anatomy basically of your face, reassembling it in a more youthful configuration, in a higher, more lifted configuration. And that's basically how you can think about a facelift. We're taking apart your face, we're moving it around so that things will look younger and more youthful, and that's a very natural, long-lasting result because we can make the face look essentially how it did or close to how it did when you were younger. If you go to another type of office, an office where they don't offer surgery, they only have injections and lasers and so on, what they're going to try to steer you towards is something that they can do. Obviously, they don't want to lose you as a client, so they're going to do everything they can with what they know and what they have. And in a non-surgical setting, what's usually done is to fill the face, as well as some Botox as well. Botox can result in some mild lifting by paralyzing some muscles that can make things a little bit more elevated. But one of the primary things that I see done in patients who want to look more youthful is to fill the face. Now, where we usually fill is in the cheek area, because as you know, when we're young, we want to have high cheekbones. So that means a high cheekbone here as well as a high cheekbone here. Any sort of fullness here is going to make the face look saggy and not as attractive and older. So one thing we can do, which I feel is more of a camouflaging thing, is to fill this part of the cheek, the upper cheek. And when we fill that part of the cheek, it almost looks like that part is fuller than this part, which may be sagging. I think that can camouflage things to some degree. Some people will say that they're actually lifting the face by plumping or filling out this area. It lifts things up, but I don't really think so. All we're really doing is making this area fuller so that this fullness doesn't appear quite as apparent. And that does give some sort of rejuvenating appearance to the face. Now, you're not actually lifting anything, and that's an important point to clarify. You aren't actually lifting and moving things like you would with surgery. This is more of a camouflage than a true lifting technique. So this can work, this can make people more youthful, but one thing that we do see is that when you fill way too much, you just start to put more and more filler because the injector wants to get a better result. Sometimes it can be overdone and patients look puffy, they don't look quite right. A lot of celebrities end up doing this, unfortunately, and it's a shame because if they had a facelift, result would be much better, more natural, and things would look much, much better. But I think this is something that we call filler face, just a face that's just too full of filler. And often we will take these patients, dissolve everything, and just start over with possibly some surgery or more judicious application of filler and Botox. Now, cheek filler doesn't last forever. It usually lasts 1 to 2 years or so. There are more permanent versions of fillers, which I don't recommend. I see a lot of those in the Middle East, and they're just a problem after a few years. Never really fully get rid of them. They cause a lot of problems. We don't use them in the US. So most of the fillers that we're using last anywhere from 1 to 2 years. So you need an injection every year or two, which is fine for a lot of patients who don't want surgery, and I think is something that works for you and you're happy with, and your injector is good at this. I think it's definitely a good plan to keep patients looking more youthful and younger over time, just having an injection a year or two in their cheek area. But once a patient gets to a certain point where their facial aging is just too pronounced and filling isn't going to work, that's really the time to start considering something like a facelift. So there you go. Cheek filler and facelifts, they're totally not equal things, but they are often addressing the same thing. One in one way, one in another way. Of course, I feel surgery is going to be more effective and natural and better But if it's something that you can benefit from, some filling of the cheek by somebody who's skilled at doing this, I think that's amazing, and you go for it. And if that makes you happy, that's wonderful. But when you get to the point where it just doesn't work anymore, that's really when you have to start considering surgery. Thank you so much for listening. If you like this content, please give us a like, a comment down below, subscribe to our channel, and we will see you next time.